Whoa. Do I have any boogies? Do you have boogies? Okay.
I did not know that. Yeah.
Do you just
I'm
want
gonna
him
be
sitting right
I'm
in the
gonna be
middle?
sitting on her chair.
Butt sharing.
Yeah, booty bopping.
Alright, rolling. Oh, we are?
Hey guys, this is Dr. Fortes, and we're coming from where are we coming from?
Behind the scalpel?
We're coming from the Kimberly office, one of the consultation rooms, and we are going to be talking about a subject that I think is particularly important and relevant and applicable to a lot of people these days. And, you know, in plastic surgery, there are always hot topics. This is a super hot topic, I think.
Yes.
And this goes back to late 2022 when we launched the program, and we did a pilot study first
Yes.
for the older generation drug semaglutide,
Yes.
also known as Ozempic out there, and it caught fire. And
Oh,
we
yeah.
had a lot of people enrolled in the program and losing weight.
Everyone wants to lose
and-
weight.
Absolutely. And feeling more confident from the weight loss. And it's a tool
Yes.
for that purpose. But this year, a new era is
Yeah.
dawning.
Everybody wants weight loss medication.
And we're going to be talking about what that means and how the program in the spa has been completely revamped and improved with a new generation of medication
Yep.
and new options and support system for patients who want to see weight loss.
Yes.
And that's that's the goal of our program. It's to help patients lose weight and maybe have them be better candidates
For surgery?
for surgery if they desire to have body contouring surgery. So we're going to talk about all those things today. But let me ask you first
Yes.
about you. Tell us a little bit
Okay.
about Ashley.
I'm
About
Ashley.
you and how you came to ACPS and how
Okay.
you landed in the spa and how you landed in this program.
Okay. I've been in aesthetics since about 2017. Actually in LA is where I started out. A little IV.
Good town for aesthetics.
Little IV vitamin therapy med spa. They had a weight loss program as well, actually, but it was HCG that was
Ooh,
used.
okay. Different kind of
Yeah,
medication.
different kind of medication altogether. So I was familiar with weight loss all the way back then when it was HCG. Then moved here back home to Texas. Rachel Fallon, Dr. Morales' PC, actually referred me to ACPS whenever the med spa was hiring. Started out as front desk. Then, we had our weight loss program here. Was really intrigued by it. Completely different medication, different approach. So I just, went to our med spa director and was like, "Oh, I have,
I'm interested.
I'm interested. I have the qualifications for it." So I slowly started helping out, and then that's when I eventually became, our weight loss coordinator.
Excellent. So you had already been familiar with the
Yes.
patient base, different drug, but it's the same patients that are coming to the program here,
Yes.
just a different medication that is being used. So what's the medication that we're using
Our
for
medication
weight loss?
is trizeptide. That's
Okay.
the one we use. It's a weekly injection. A lot of benefits, completely different than semaglutide, which is what we previously used. It's a lot more beneficial and less of, the negative effects that they were experiencing with semaglutide.
Right. And, these drugs are modern drugs
Yes.
for the purpose of two things. They were developed really for managing type 2 diabetes,
Yes.
which is such an important condition to,
Yes, very important.
manage. But they're also used for weight loss, and they're very effective for that. But they come out of studies that go back to the 80s, I think I remember.
That is ridiculous. I didn't know it
Reading.
went that far back.
Yeah, they did. And basically, research looking into the function of hormones that are secreted in the gastrointestinal tract. And all these different hormones work to regulate how the body works, how appetite is stimulated or suppressed, how insulin is secreted or not secreted, how the gastrointestinal tract moves and propels food forward in the digestion process. Many hormones have been
Yes.
identified, and from those studies, drugs have been developed that mimic the effect of these hormones. So, tirzepatide is one of those drugs that
Yes.
has that hormone or those hormone-like properties, like the native hormone in the gastrointestinal tract. Two of the ones that were identified, probably in the last 40 years, GLP-1, and there's
Yes.
been
A
a
whole bunch of those.
slew of drugs, but the GLP-1s that basically are hormones that live in our bodies are glucagon-like polypeptide, one. And then the other important one, and tirzepatide functions in this capacity, is GIP,
Yes.
and it goes by basically two names, gastric inhibitory polypeptide, and then get ready, the long one, glucose-dependent insulinotropic polypeptide.
It's a tongue twister.
That's a super tongue twister. But what they do is that they regulate appetite,
Yes.
they regulate insulin secretion in the body in response to ingesting a meal
Yes.
and having glucose flow through the digestive tract. And they have effects on the motility of the gastrointestinal tract. So they have beneficial effects in glycemic control, meaning the control of glucose. So they work great
phenomenal.
in controlling type 2 diabetics. But because they also suppress appetite and slow down the digestive tract,
You see that weight loss.
they have weight loss as an effect.
They
I'm not
hit
going
a-
to say side effect. It's a positive
It's a positive
effect.
effect.
So the original drug that was launched, believe it or not, back almost 20 years ago,
That's crazy.
2005, was a drug called Byetta. It still may be available now for use, although now
There's so many more beneficial ones
newer
now.
generations have come since then. And then I remember back in 2010, there was another one called liraglutide, which went by the name Victoza, another GLP-1 drug that
Very
helped.
popular.
Yeah, exactly, for the same purpose. But with each year, new drugs are being developed. In 2020, late 2022 and all of 2023, the big drug that everybody was talking about was Ozempic,
Yeah, that was a big craze.
which is semaglutide. But now this year we have
Tirzepatide.
tirzepatide. Yeah.
Yes, sir.
Also called Mounjaro.
Yes, also
Yeah.
called Mounjaro.
And it has those two effects. It has
Yes.
GLP-1 effect, positive effect, and it has GIP
Yes.
effect as well.
So it's a dual little drug.
Yeah. So, I mean, I'm just fascinated by the history of this research.
I didn't know it went way back
Yeah,
then. I
I
mean,
know.
people were trying to lose weight even back then.
I know. Well, and they were using old-fashioned drugs, like the
Yes.
stimulants that made people kind of jittery. Fen-phen, remember those? You probably are too young to remember fen-phen.
I think
but
so.
anyway. And then the drugs that inhibited the digestion of fats, that,
Yes.
bloating and diarrheas,
All those
unpleasant,
nasty effects.
unpleasant side effects. But these newer drugs and newer ones are coming down the pike.
Oh, there's a new one I think coming out next year. It's
Yeah.
just always improving. Something else is coming out. You can never keep up.
I know. Well, that's the exciting thing. We think that the current drug is the end of the road, but it's not. There
It's
are
just the
new ones being
beginning.
developed, new ones that are more effective and better tolerated.
Yes.
Which is the exciting thing. A new combination of drugs, too.
Yeah, but that's the world of medicine, always improving.
So we have a weight loss program. I mentioned the history of it that, we launched back in late 2022 and all of 2023, and then it's been supercharged.
Yes.
And now
New
you
and
are
improved.
involved in it. Tell us a little bit about the program here at
So
ACPS.
our program, we have 3 different options. We want this to be a tool for patients to lose weight. We don't want this to be like your lifelong medication, like your crutch. This is a tool to kind of jumpstart that lifestyle change for you to really lose the weight, but also maintain that weight loss, even when you're off the medication. So we do have a couple of requirements. We do require blood work. We just want to make sure all your labs are normal, especially your thyroid levels. We want to make sure those are normal. And then we also do require a thyroid ultrasound. It's really hard to feel physically if you have any nodules on your thyroid. So
Yeah.
an ultrasound.
I did my best, the last 2 years feeling
I know you did.
next.
I know. It wasn't the best thing in the world, but I know you tried really hard. but we're going to stick with the ultrasound now so we can really get in there and look at it.
So why are ultrasounds of the thyroid important?
So we just want to make sure that you have a normal functioning thyroid. A lot of patients don't know if they have, a hyperthyroid or a hypothyroid, or there's a lot of patients who their family has Hashimoto's disease. They're not even aware if, they are developing it yet, since it is a very slow progressing disease. So the thyroid ultrasound just really helps us rule out any pre-existing thyroid conditions you
Right.
might have.
There are also hard no's for the use of this drug. One of them
Yes.
is patients who have a history of kind of thyroid cancer
Cancer.
called medullary thyroid cancer, or even a family history of it. And
Yes.
so a thyroid scan helps identify nodules that might be suspicious
Yes.
for a cancer.
It's just good to know as well. Rule anything out. Once we have, those two results and you're a good candidate, you have your consultation with Dr. Morales, one of our wonderful surgeons here as well. Of course, you're my favorite though, Dr. Cortez. But after that, you're approved for the program. We have options with a nutritionist and a trainer. So, if you're
And
not.
that's new in the
Yes,
program.
that is new. We didn't offer that before. So if you have, horrible eating habits, a nutritionist would be great benefit
Who doesn't
for
like
you.
junk food?
Everyone loves junk food.
Yeah.
But on this medication, if you're not eating properly or, clean foods, your body's going to hate you for it. You're going to have those negative side effects and you're just not going to feel your best. Trainers as well. We now have trainers. Same thing. They can set up a workout schedule for you in a gym, at your own gym. And then we also have Lauren, our head nurse of the program.
Right.
You have monthly follow-up visits with her, and we also do Staiku body scans now.
Yeah, that's kind of cool. I just saw it, about an hour ago.
Yes.
What does that do?
So
Tell them
it's
what the
a
scan does.
3D body
It's
scan.
really, really cool.
It is. It's a really neat machine. It helps us weigh you, but also look at your body fat percentage, lean mass, bone density, your measurements throughout your whole body. So a lot of patients think when they look at the scale and they're not losing pounds, that kind of discourages them.
Yeah.
With this IQ scan, though, we can see that you're losing inches, which is really beneficial as well. And we also want to make sure you're strictly losing fat. You don't want to lose any muscle, anything like
Right.
that. So it helps us supervise that you're losing weight correctly. You're not.
And lean tissue, muscle, is more dense than fat.
Yes.
So you might be leaner, tighter, fitter, and weigh the same or even more. So it's
Yes.
not, the weight is just one metric of following up patients. And the same thing with BMI. BMI is kind of a quick assessment of where a person is in terms of their height and their weight, but it doesn't tell the whole story.
No, it's
because
not very accurate.
No,
Just that.
BMI doesn't really strip it down to what percent of your body is fat versus what percent of your body is lean tissue. And so, I mean, as an example, patients who really hit the gym hard and become bodybuilders with, hard muscular bodies may weigh a lot,
More.
but
Yes.
I wouldn't call them fat at all.
No,
because
muscle
they're
weighs
super lean.
Yeah, muscle weighs more than fat. So if you're working out correctly, you're gonna gain weight, but you're gaining muscle. You're not gaining fat. So
Right.
that scan really helps us break everything down and show patients like, hey, the scale might be going up, but you're also working out 5 times a week. You're losing fat, but you're gaining muscle.
Right. So it's really a holistic approach
Yes.
that the program follows, not just giving patients the drug and saying, here's the drug, good luck,
Bye.
inject yourself at home, and I hope the best for you.
Call me if-
Vaya con Dios.
Yeah. Call 911.
We're following them very, very closely.
Yes.
With you and Lauren, and getting scans monthly, and seeing what their weight is, and seeing how they're doing with the drug use. And we're actually having them come in also, if they desire, to have the drug delivered by
Yes.
injection. And by the way, how does that go? How's the drug? It's a shot
It's a
that's
shot,
done
yes.
once a week.
Once a week.
How's that done?
So it comes in a vial. I know a lot of people see like the pins. That's a big way to administer it.
Yeah.
Our medication is in a vial. We show you how to draw it up, or if you come in weekly for your injections, I am also the wonderful MA who will do your injection. So,
Okay, so you're
um, I,
instructing them how to do it,
yes,
and they're watching you, in case they want to
do
kind
it at
of do it at
home.
home, if they get familiar enough on how to do it,
Comfortable enough.
with you
Yes.
monitoring them in the first 1 or 2 months, they can maybe consider doing it on their own.
Themselves. Yes. It's really easy. It's a subcutaneous injection. It's done with a small, thin insulin syringe. The needle's very tiny, short. We show you how to draw it up. On the needle, it's, measured in units. It's really easy to not mess it up.
Right.
Just we tell you, okay, you're gonna do 30 units, draw up to the 30. It's
Draw up to
very
this line.
draw up to that
make
line
sure.
right here. Try not to get any air bubbles. It's really simple, but some patients do have a hard time, injecting themselves
Right.
with needles.
Well, it's an easy thing to do, but it takes education,
Education,
right, and
practice.
practice.
Yeah, but we show you. I can administer it for you. It's not a big deal. I got you.
Well, tell us a little bit about the safety of these medications.
So it is monitored every month, or honestly every week, by Lauren. We try to keep you at a low dose. This program is really tailored for that individual patient. So we start you off at a low dose just so your body gets used to that medication being in your system. And then once, that first 4 weeks are over with, we can increase your dosage very slowly, again, monitored, so you don't have any negative adverse side effects or anything.
Yeah.
So it really is tailored to that specific patient. But our goal is to keep you at a low dose. If you're losing weight successfully on a low dose, we're not going to increase you just to increase your dosage.
What? So you set goals for patients.
Yes.
Or patients really set goals for themselves, and we monitor them. What would you say is the ideal way to lose weight in terms of pounds per week or pounds over the course of the treatment?
So the ideal goal would be 1 to 2 pounds a week. That's what we would like to see.
Slow and steady.
Slow and steady. We don't want you to drop, 10 pounds in a month, or
Yeah.
that's crazy.
Or in a week.
Yeah, or in a week. It's not safe. We don't recommend it for you. This is a slow and steady program. You have to put in the work.
Yeah. When patients are on the medication, what can they expect? Obviously, the goal is to lose weight,
Yes.
but no drug is without its side effects. So what
Correct.
can patients expect while they're on this medication in terms of side effects to look out for?
Some typical side effects, headaches, nausea, constipation. Those are the main ones we're seeing, or even, gastric reflux, side effects. A lot of patients feel like they're burping a lot. They just have a lot of that reflex after eating. Most of the time, that's because you're not intaking enough water, or you're eating still a lot of greasy, sugary, or you're not eating at frequently, because the medication does curb your appetite. It makes you feel less hungry. So the patients are like, oh, I'm not hungry, so I'm not going to eat. I'm going to skip my meals.
Yeah.
And then here comes the nausea. So those are the common ones.
Right.
But if you are drinking enough water, eating small meals throughout the day, that will kind of alleviate some of those symptoms.
And the drug really is there to tap you on the shoulder to remind you to eat better,
Yes.
to eat less large meals, sort of
Small,
better
frequent
nutritious
meals.
foods, smaller quantities, and also incorporate exercise.
Yes.
So
Exercise.
it's really giving patients that time to make lifestyle changes.
It's altering
because-
their mind.
Yeah, because it's not just the drug that's going to help them maintain the weight loss. It's really the changes in their
The
lifestyle.
eating, yes.
The eating and the
Exercise.
exercise. Because at some point they're going to be off of the medication, so they have to rely on the new system of life to propel them forward.
Yes, you don't
and
wanna-
to maintain.
Go through all that hard work just to gain it all back and be stuck again.
I know. Who are ideal candidates, would you say? for this program?
Ideal candidates, if your BMI is, between 25 to 45, ideal candidate. Unfortunately, you're not a candidate if you have diabetes,
Yeah.
or if you have a history of thyroid cancer. Unfortunately, that would not qualify you for the program. Those are the two main things that would turn you away.
Well, because this is a drug that's used in the management of diabetics.
Yes.
We don't want to
We don't
add
want
to that regimen. The diabetics are already under control by an endocrinologist who has them on a regimen to control the
We
diabetes.
don't want to mess that up.
So we're not in the business of treating diabetes type
No.
2. So it's pretty much healthy people. Now, you mentioned something that I thought was very interesting. It's pre-diabetics.
Yes. If you are pre-diabetic,
Yeah.
you can be on the program. It would
Right.
actually be really beneficial for you to be on the program.
So you were saying you killed two
Kill
birds
two
with
birds
one
one
stone.
stone.
You lose the weight, you get better glycemic control, meaning the pre-diabetes may go away completely.
Yes.
Which is a good thing. People often think, oh, it's just pre-diabetes. That's nothing.
But
It is
once
something.
you hit diabetes, you're there.
Well, pre-diabetes is a knock on the door.
That's your warning.
It's a warning into type 2 diabetes.
Yes.
So this is a drug that works great on both counts. So we talked about who are ideal candidates. Who should not be in this program?
Patients who have type 2 diabetes should not be on the program.
Yeah.
Same thing, history of thyroid cancer should not be on the program. Also, the Hashimoto's disease, you
Yeah.
should not be on the program. It's a lot of patients don't realize they have these conditions or are, creeping up on these conditions. So that's why we require the lab work, the thyroid, ultrasound. Honestly, a lot of people don't get lab work done like frequently, now that I think about it. So it's a very important step. Like, get your lab work done, guys. Just once a year.
At least know your baseline.
Yeah,
right?
know your baseline.
Know where you start. Because some people may be walking around there with raging diabetes, raging high
have
blood
no
pressure,
idea.
and absolutely have no clue.
Yeah.
They're just living life and probably keeping bad habits and coming in and saying, I heard about this program at ACPS. Let me go in and check. And they learn a lot.
They do learn a lot
about their health.
There have been some patients where we had to be like, you need to go see your PCP and get this checked out.
Right.
They're like, I had no idea.
Right,
We're
right.
saving lives, honestly.
People kind of joke about plastic surgeons being frivolous,
yeah.
and we don't save lives, we save egos. I think we can save lives.
We save
on
lives.
this one.
Yes, we definitely do.
Well, there are myths about being on this drug. I guess run us through a few of those myths people should know are probably true or not true.
A lot of myths. I mean, people think that they will get this medication and they can lose 100 pounds in, the 24 weeks. They think this medication is their like holy grail. Like, oh, I just give myself the injection. Let me go sit on the couch, eat my potato chips, and
So
I'll lose
they
the weight.
do no part
Yes,
as an active participant in their health to make changes,
correct.
which is probably not a good thing to do.
It's not a good thing. Your body will react badly to you
Yeah.
continuing those bad habits.
I had a patient recently that asked about the program, and somehow that the drug sort of melts the fat away from your body.
Yes. People also think that
Which
they
is
can.
that's a big myth.
Yes, it
It
is.
doesn't work that way.
People also think that wherever they do the injection, that is where it will target the weight loss. So it is a subcutaneous injection. We administer it.
They think they're going to have like a hole
Yeah,
where the fat goes
that
away.
it's just going to disappear
Where they
right there. And
shoot
some
themselves.
patients are like, well, I saw on YouTube it's more beneficial to inject myself in the thigh or in my groin area. So
Okay.
I'm going to inject myself there because I'm going to have less negative side effects and it's going to speed up my weight loss. That's a myth.
Yeah.
Don't believe everything you see on
Right.
YouTube.
Where it's injected is just the entry point.
Yes,
And
that's
then
all
it
it
has
is.
systemic effects on your body. So it doesn't matter if it's in the stomach or wherever it is that you're
Stomach.
injecting subcutaneously. It's going to have its effect throughout the body,
Yes.
not just in that area.
Just not in that one region. You're
Yeah.
not going to just lose all that fat in your thigh if you put it in your thigh.
Now, one important thing that people should know, and the studies bear this out, is that when patients stop taking the medications, there might be some weight gain.
Yes.
Run us through that. What happens there?
So if they're experiencing weight gain, our program is for 24 weeks, so it's about 6 months. Let's say you met your weight loss goal we require you to be off the medication for at least 3 months. After 3 months, if you have experienced weight gain, you can be reevaluated to be back on the program.
Yeah.
But the
Second chances.
second chances, yes. But we are going to require lab work again after 6 months.
Starting fresh.
Starting fresh.
Yeah.
You don't have to do the thyroid imaging, but you do have to do lab work because you've been off of it for 3 months. We need to see where you're at in your labs with your levels. And honestly, people don't realize even when they skip injections after a couple of weeks, the medication completely leaves your system after
Yeah.
2 weeks.
Right.
So there is no self-dosing in this program either.
You know, the fascinating thing, and I told you that this is, an area of intensive research that identifies these hormones that naturally live in the body.
Yes.
But the body secretes them in different parts of the body, but their effects are transient. 1 or 2 minutes. When you eat a meal, these hormones are stimulated, and their effect are fleeting. 1 or 2 minutes, and they're gone out of your system. They're just there long enough to remind you, okay, that's enough. You don't need to eat anymore, or you should be full.
Yes.
Or let's have the body sort of slow down and digest the food that it's taken in, or let's get insulin ready to be secreted so we can figure out what to do with all the sugar that you've consumed. But these drugs have been modified so that their effects can last
Longer.
a week.
Yes.
That's why you can dose them every week,
Yes.
rather than several times a day.
And it really peaks after 24 hours of you receiving your first injection. That's when
Yeah.
the medication really peaks and you can start feeling those effects of it. It's all fascinating.
It is amazing. There are always positives and negatives to the use of medications. I've said this before. I think that these drugs are here to stay. I really do.
Forever.
Because they're treating two major societal epidemics, I think.
Yeah.
Morbid obesity is
It's a
a
huge thing.
huge thing. And equally huge is the explosion of diabetes, even among young people.
Oh, yes.
And so these are drugs that have been developed for the purpose of giving people the option of controlling those two problems simultaneously.
Yes. Simultaneously. 2 birds, 1 stone.
Two birds, one stone, and literally give them a chance to make changes in their life, whatever they are, eating better, exercising more, losing weight,
Yes.
and getting used to those new habits. So I think these drugs, the genie's out of the bottle, as far as I'm concerned. I don't think we're going to reverse the clock. If anything,
No.
I think we're just going to keep moving forward
Yes.
and develop better drugs that are tolerated better and are going to be more effective for patients.
Which is good because then they lose weight and then they come to our wonderful surgeons
Exactly.
and get their surgery done.
Exactly. Certain patients just don't meet criteria for having surgery. The criteria that I use for having a body contouring surgery in particular is that they have to have a BMI. And I know we said that that's kind of, a rough estimate of, health. But for me, the cutoff is BMI of 40.
Okay.
Because the studies bear out that when patients who have a higher BMI have surgery, then the risk.
Right.
And so we'd be remiss in doing plastic surgery in people who are at high risk for these operations that we do. So number one, let's get the BMI in
Lower.
better control. And so this is a great way to do that.
Yes.
And one of the consequences of losing weight, especially significant weight, and we've seen it with years and years of taking care of post-bariatric patients
Yes.
who have lost 50, 100, 200 pounds. What happens? They have
Excess skin.
excess skin. They've lost the weight, but now they have
The skin.
saggy skin all over. And the same thing can happen in patients taking these medications. They
Yes.
can lose a significant amount of weight so that they might be candidates for body contouring surgery, whether it's liposuction to remove stubborn fat, the fat that just refuses to go away,
It just wants to stay forever.
wants to stay, and the excess skin.
Yes.
And there are multiple operations: tummy tucks, body lifts, breast lifts, even face lifts,
Oh, yeah.
because
Anything that is sagging can be lifted.
can be lifted. That's my job.
That's your job. Yes.
And I love it.
Yeah, you're
But I
gonna.
love doing it on people who are ready.
Yeah, we're
to have the
candidates
job,
for
so-
it and are healthy. That you feel confident going in there,
Right.
fixing their sagginess.
Exactly. Now, you mentioned to me that there's like a little perk for patients who probably see
Ooh,
this and come to the
yes.
spa and have an additional level of motivation to come in and be evaluated for the program and even
Yes.
enter the program. What's
Yes.
that?
So if they are going to enter our program, if you become part of our program, we have partnered with MyFitFoods. This helps the nutritional aspects, meal prepping. I've actually tried some of their meals, really good. So if you're part of our weight loss program,
Probably easy. You don't have to think
it's really
about it.
easy. Like you just pop it in the microwave, I think
Yeah.
for like 2 minutes, and it's like a whole meal. Like
Right.
it's really good. Full on. I had like a turkey mac and cheese
And
one.
probably
It's
not
good.
junky food.
No, very healthy, clean food. It's all portioned out, so you're eating the correct portion. It's going to be really hard for you to overeat
Right.
unless you're grabbing a whole other
Especially
meal.
with people who have had an entire life
Oh yeah.
time of having difficulty managing what they eat.
And how are they just going to magically one day know how to?
They can't.
No, it's
So
a process.
this is a way to help regulate that.
Yes. So MyFitFoods is offering 25% off
Yeah.
their meals if
Yeah.
you are part of our weight loss
We don't
program.
get any kickbacks from this, by the way.
No, we don't.
We don't.
No.
We do it because it's good for our patients.
Yes. So 25% off the meals with MyFitFoods if you're part of our weight loss program. They're really good, clean, beneficial. You can pick them up from one of their several different locations, or they actually deliver to your home.
Wow.
Yeah, so it's very
Very
convenient.
convenient.
Yes, very convenient.
Especially these days.
Oh,
And
yeah.
everybody's busy.
Everybody wants to Uber Eats, even like HEB. You know, you have that curbside pickup.
Yeah.
I have not gone inside the grocery
Right.
store in forever.
I know.
It's curbside.
Wow.
Yep.
I should check it out.
You should. You don't have to go inside at all.
Give these guys the take home messages for the program
It's
and how they can contact you
schedule?
and schedule. Yeah.
Yes. If anyone is interested in scheduling, you can contact me directly, 713-354-5130. I'm available Monday through Friday, 8 to 5. I am there literally every single step of the way. During your consultation with Dr. Morales, before your consultation, your follow-ups with Lauren.
She'll hold your hand.
I
the
will
entire way
literally
through.
hold your hand the entire way because this is a tool. We want patients to be successful.
Yeah.
It's a whole new program, accountability. We want you to change that lifestyle. And then we, if you're interested in surgery, we really want them to, be successful, healthy, get approved for that surgery and go to you guys afterwards.
Yeah.
That's the goal.
So it's literally the journey.
It's a
of
journey.
patient.
It is a weight loss journey. This is a full-on program.
The weight loss is the first
Yeah,
step.
that's the first step. And then you
and then
have
maybe
your consultation with Dr. Fortes to
the
fix
surgery. Yeah.
everything else.
To look even better.
Yeah, you be walking around a whole new person.
I know. Well, this has been fun.
I know, I liked it.
You know, I love this subject. I really
Me too.
do. And I think it's so relevant to today. And I think so many people can benefit
I
from
think,
this
yeah.
program
Especially,
that we're offering.
we're very realistic. When you look online, you
Yeah.
see like, oh, Kim Kardashian did Ozempic and she lost like 50 pounds. Or Scott Disick. Did you see Scott Disick when he did
No.
Ozempic? His face was like sunken in. Like,
Right.
like a fish.
I can fix that.
You can. See, Scott Disick. Call Dr. Fortes. But no, this is very realistic. Set goals, change the lifestyle. It's a really fascinating medication overall, how it's constantly improving
Yeah.
and, changing. But we want patients to really make this lifestyle change and use it as a tool, not
Yeah.
a crutch. That's our
Right.
main goal.
Absolutely. Well, guys, this has been fascinating, wonderful, and
Thanks for having me.
great. Oh, I love talking to you.
Me too. I love talking
We,
to
we should
you.
do sort of a follow up on
Yeah.
how things are going because literally we just launched 6 months ago.
Yeah, 6 months ago.
Yeah.
It's
So
moving
the new
fast.
program is new,
Very new, yes.
and I think it's a tremendous success. We had a success with the old program,
But this is
but
better.
this is like up there.
Yeah, this is
with
high quality.
really offering a complete service to
Yes.
patients all the way through,
This is a concierge kind of service, guys.
which is wonderful. Well, guys, it's been wonderful chatting about this program here at the ACPS, the weight loss program. I look forward to new episodes in the future, and until then, you guys have an awesome time.
Bye.
Bye-bye.